And we are officially live on my Facebook page at JMatt MKE. Today for Self-Care Sunday, a feature that we've been doing all the month of May because May is Mental Health Awareness Month. Today's topic is going to be on anxiety, and I'm joined by two experts in anxiety, Dr. Rachel Buehner, who is a psychologist or a licensed psychologist, and Leigh McNabb, who is a program director and radio personality for Iowa. So feel free to introduce yourselves and give a little bit more background on yourselves.
Dr.
Rachel,
you go first. Yeah.
I said it first. Go ahead.
Oh, no. Okay. Hi, I'm Leigh McNabb. I program 93.3 KIOA in Des Moines. I'm at JMatt 10-ish years ago, maybe.
6,
You had graduated college and I was working in Milwaukee. And actually, interestingly enough, I think you and I met in my prime onset of anxiety extravaganza. So the fact that you still speak to me is great. And it's funny when you said people that Rachel and I are experts on this. She's the expert. I'm just the expert in having freakouts and telling you all about them. So
you have the experience, though.
Yeah, there you go. Very experienced, very, very wise in the ways of anxiety. But I even today have a lot of questions that I want to ask the doctor. So let's hear about her.
Hi, I'm Rachel Buehner. I'm in Louisville, Kentucky. I'm actually licensed as a psychologist in Kentucky and Ohio. I do telepsychology, so I work in a private practice that does psychology, and so individuals can call in for video therapy from either Kentucky or Ohio. I've been working for about probably 12 years in this field. I've had my doctorate for 3 years now, and I am the president-elect of the Kentucky Psychological Association.
Fantastic. Well, thank you both for taking time out of your Sundays to chat with me about anxiety. For those that may not be aware, what is anxiety?
So the Diagnostic and Statistical Manual, which is sort of the Bible for psychologists, defines anxiety as excessive worry. You're going to see probably sleep impairment, changes in appetite or weight. You're going to see sometimes one would feel edgy or irritable. They may have difficulty with focus, and they may carry tension, maybe like the typical, like you think about shoulder or back tension. It could be PMJ kind of stuff in the jaw, when you wake up with a headache because you've been grinding all night. So one of the symptoms that you might look for would be that tension held somewhere in the body.
Yes, all of those things.
Yeah.
Right. So we diagnose it. So I don't want to interrupt you, but we diagnose when you see a cluster of those symptoms, a certain number out of a certain number, we would diagnose anxiety. And there are different types of anxiety. So you may look at generalized anxiety, which is sort of a sense of worry and edginess about a whole bunch of stuff at once, nothing in particular, just a whole bunch of stuff. You might look at social anxiety, which is where you're afraid of performing in front of people or afraid you're going to panic in front of people or in front of large groups. You might see panic disorder sort of related to anxiety. It's that idea of I fear that I'm going to have kind of a meltdown or a panic episode. So it's not just having the one, but it's fearing the next one. So several different types of anxiety out there.
That's a real thing.
Yeah, I actually didn't realize there were so many different versions of anxiety. I knew about the panic attacks, and I just assumed everything else was just anxiety.
And anxiety about anxiety was actually on my list of questions to bring up today because that's a thing. Like, okay, I got out of the house today and I went where I needed to go and I was successful in getting there. But now in my head, I'm thinking, but is it a ticking time bomb? Like, will I be walking through the mall and run into a friend? And that's one of the ones that, pops in my head. What if I'm in the grocery store and I'm in the chip aisle? Do I just avoid the chip aisle sometimes? But that's a real thing. That makes me feel a little bit better. Anxiety about
it's
anxiety.
It's a real thing. We stress about our stress. We stress about when the stress will escalate, what that will look like, how that will appear to others. We might start avoiding certain places or people because we're fearful of our reactions. And so you wouldn't necessarily diagnose anxiety or the different types of anxiety unless there's a functional impairment. So can you go about your day? Can you go to work? Can you go do the things that are important to you, be with your family, at school, whatever it is? And it's sort of a subclinical kind of thing that happens, or is it a full-blown, like it's keeping me from doing the things that I want to do in my life? And that's typically what will bring somebody through the door of a therapist's office.
Wow. Kind of going off of that, how does somebody prevent it from becoming an anxiety that inhibits their abilities to go out and do things and live their life to their fullest?
Well, that's a good question. I always tell folks in therapy that, a marathon is 26.2 miles. And in therapy, if you're trying to kind of figure out when is that thing happening, what does it look like, and to recognize it in real time, recognize it in real time when you're dealing with anxiety is like the first 25 miles of therapy. It's really learning to understand, like, I'm doing that thing in my body where I'm getting tense or I'm getting really like worked up in my mind. My thoughts are racing. I can't slow it down. You feel like you're sort of, how you thought like you're anxious about anxiety, you're overthinking that kind of stuff. It's when you're able to stop and notice it, where you think, this is keeping me from going to places that I want to go or being with the people with whom I want to hang out. That's when you would typically start to hopefully ask for help.
Okay. Leigh, for you, what does anxiety feel like when you realize that you're experiencing it?
Yes to all the things that Rachel said. So I'll tell you, the first time I ever had a panic attack, I had done a station event in Milwaukee. And at the time I was living in Chicago. So I had to drive from Milwaukee back to Chicago. And I was in my car and I thought, I'm having a heart attack. I think I'm having a heart attack. Like, it hurts and my heart is racing and I can't catch my breath. And I'm thinking, I need to pull over my car? Like I was a pretty healthy person at the time, and I was young and exercising and all of the things. And I thought, out of nowhere, I'm having a heart attack in my car as I drive home. And I got to the exit and I kind of got off and got into my neighborhood and got home and was up the entire rest of the night because, I mean, heaven forbid I actually call and look into the fact that I think I'm having a heart attack. I didn't do anything about it. I just sat there freaking out that I thought I was having a heart attack. And it wasn't a heart attack. And then I had to think, and I was already in therapy for depression, but never this anxiety stuff. And I thought, okay, well, this is in my depression and anxiety workbook. I've read about this. This might be a thing. Better bring that up when I go, whenever my next appointment was or whatever. So that's an option. That actual panic attack can happen. Another time I was with my mom and my sister in the mall and we ran into a friend and all of a sudden my heart starts racing and I just start sweating. That's another thing. Lots of sweat. And I'm like, how do I get out of this situation? There's nothing scary about being at the mall with your mom and your sister and running into a friend. But at that moment, I was like, I can't be here. I can't talk to this person. I somehow need to tell my mom and my sister that we need to leave. And they don't have any of this anxiety stuff. So they have no idea why all of a sudden I'm quiet and sweaty and standoffish and all these things. After the fact, I said, hey, we might need to come up with like a code word or something in case this happens. Because,
so smart. That is really smart.
Because I needed to get out of there. And heaven forbid I just say, hey, I need to get out of here. I didn't want to seem rude or whatever. So I think there's that kind of anxiety where there's panic attacks. But then the avoidance of things, social media has been a really interesting eye-opener for me. The memories that come up on social media, there are tons of memories that come up that my husband is in with our friends and I'm not in them. And I think back to those days or those events or whatever, and I know where I am. I'm back at, a lot of them are when we lived in Kansas City. I'm back in our loft by myself because I didn't want to go or I couldn't leave or I was stressed out or, and it's going to hang out with your friends. Like, why is that stressful? I don't know. I still can't tell you why that's stressful. But looking back at memories on social media and seeing all the pictures that I'm not in has been really eye-opening to me, even just in the last couple of months. So I wonder if you have patients that have kind of been able to see through social media some of the things that they're missing out on, because that's been a thing.
I think so. And not necessarily even just memories, but realizing that other people are still interacting out, doing things like thriving during a pandemic, exercising, you know what I mean? Doing Zoom talks with one another and Zoom cocktail hours. And there are other folks who kind of are hiding away from the world because the world is some extent a very scary place right now. So when you catch yourself pulling back from things that you used to really enjoy, or things that used to bring you joy, that's one of those sort of signals for us that maybe we needed to start taking a look at something. So I like what you said before about enlisting your family support. It's really tough for a lot of us to do, but it's again one of those things where if you're able to recognize, like, I'm having that symptom where I feel like the world's closing in on me, or I feel like I have to get out of here right now. I can't stay in this moment. The fact that you can be vulnerable with people who love you and say, this is going to be our code word in those moments, just love me. Don't try to talk me out of it. Don't try to necessarily do this, that, or the other. Just take care of me and help me feel safe. And then you can be talking to somebody, you know, hopefully a professional in your off time, to kind of establish, like, what sort of things set that off for me? What can I do in those moments to start to relax within myself? How can I promote a feeling of safety within myself? But I just love that you asked for help. That's a great indicator for you.
Well, why does this happen in general? Like, why are there some people that can go to the mall and run into a friend and be a normal human being, or go hang out by the pool with their friends on a Sunday and it's not a big deal? And then there are people like me who it's like, oh my gosh, I'm in the department store and I'm sweating and I have to leave. Like, why am I the way I am?
That's a really good question. So if I were working with you in more of a therapeutic kind of relationship, we would take a look at the sort of history of these symptoms. So a therapist would work with you and say, tell me about when you started noticing this emerging. And in your case, based on what you've said today, that might look like, when did you start withdrawing from things that you enjoyed? Or when did you start noticing that feeling of being really frightened in a situation where in the past you wouldn't have been so frightened? And some people's stories may look like, I've been kind of nervous around people since I was in elementary school. And other people will say, it happened last year after I got kicked out of school, or I lost a job or something like that, like when there was some major change in their life and they sort of changed the way that they interacted with the world. And there's not always a precipitating event where you can go, there it is, necessarily, but you can sometimes know when the symptoms emerged for you, and then we can start to sort of fill in blanks. Like, what did that feel like for you around that time? Human brain is amazing in the ways that it will try to avoid feeling pain in the future. So if you think to yourself, if the mall for some way, shape, or form is stressful for you, your brain will suddenly start to say, we can't go there. We shouldn't be here. Let's get out of here. We don't know exactly why, but we can start to kind of deconstruct some of that in therapy and say, what's alarming about it? When did you notice it start happening? What was going on in your life around that time? And it can start to make sense to you why you developed this sort of survival system. It wouldn't seem like the mall is a big stressor, or shouldn't necessarily be a fight or flight reaction in the brain that goes on that says we're under threat. This is like the saber-toothed tiger to the caveman, right? Like, our brains haven't really developed too much further along from that, believe it or not. So if your brain perceives it as a threat, even though rationally you think nothing's wrong, I'm with my family, this is a safe spot, you know what I mean? But if your brain perceives a threat, going to set up all of those same mechanisms that tell you get out of here and get out of here fast. So your heart will race and your mind will race and you might get sweaty in your palms. All the things that say we're either going to battle or we're going to get the heck out of here. That's what's happening during those sort of panicked moments of kind of getting a feel for when it emerged. And in those moments, what do I do to promote a feeling of safety within myself? So how did I get here? And what do I do with it when it happens to me? Those are two of the things that you might work on. One might work on in therapy.
It's interesting. Oh, go ahead.
Is it safe to say that a lot of the anxiety that you feel now or in the future is caused by something in the past, some sort of experience or something, even genetics wise?
I think that that's a fair assumption, yes, that there's usually some sort of history or precipitating or triggering event. Somebody may look like something similar to your background that was alarming for you in the past. Like I said, I've always explained it to people, like, our brain will do lots of things to keep us from avoiding that pain. We will do things to avoid that boogeyman around the corner. So it looks like changing behaviors. It may look like avoiding certain types of people, avoiding certain types of environments or places. And the way that you know, like, this is maybe when I need to talk to somebody is it keeping you home? Is it keeping you hidden away in the loft while your partner is out having fun? Is it keeping you from doing things with your kiddos that you want to be able to do? You know what I mean? And if it's inhibiting you from being able to live your life, hopefully when you get on the internet or, make a phone call to talk to somebody.
Gives me the cry ball because it's just like real life, and for me, some of that stuff is seeing it after the fact and seeing there's everybody at the pool that day when they did X, Y, and Z. Or I remember we had an ornament exchange and people made ornaments with pictures of the group of friends together. And I wasn't in any of the pictures because I wasn't there. And it's weird, I think, probably for people who know me via radio to hear that kind of stuff, because I talk for a living. I get on stage and announce concerts all day. I do things like this. I do podcasts and whatever. My husband is in radio as well and super like out. But I think that's a really easy way for me to like fake it and avoid it. If I'm just Leigh McNabb from the radio up there, it's not really Leigh McNabb Wicket, the mom, wife. Yeah, to an extent, a little bit. It's an easy way to hide. So, but it is also hard to explain to people. Like, JMatt, do you have anxiety, or is this just one of your topics?
This is just a topic. I don't have anxiety. I have other things, but
right.
Yeah.
It's hard to explain to people in our world, you and I both being in the media. For example, you're talking about Zoom calls being a thing now. And every Friday night we've been doing a Zoom call with a couple of friends that JMatt and I have in common. And every Friday night my husband's like, yeah, we're going to make our drink, or we're going to log on to the Zoom call, and we're going to do this. And I had to tell him, I was like, I'm too anxious about it. I can't be on the Zoom call. And he's like, it's our friends. Like, what is there to be anxious about? You just sit there and talk with your friends, and you do that any day anyway. And I'm like, no, I can't, like, I can't fill the silences. And when people talk over each other, and sometimes people's microphones work and other people's microphones don't work. And then we're trying to talk and people can't hear you. And what if someone can't hear and then they feel like they're not being talked to? So then they're left out. And I just like spewed all this. And I still don't think he gets it. I still think he's like, we're talking to our friends on a video. Like, what's your problem? But there's another thing where it's like, I don't know if I can do it. I might just go hang out with the kids in the back room and tell Kitty Cat Matt I say hi.
That's one of the kind of hallmark ideas, though, with anxiety, is being highly conscious of things. So how are people feeling? How is everyone in the room feeling? How is everybody thinking? How are people perceiving me right now? Trying to understand all the sort of potential catastrophes that might happen based on the environment that you're in right now. So what you're describing is, I say respectfully, like classic kind of manifestation of anxiety, saying, I can't do this thing that should be really comfortable for me, but there's so many things that could go wrong, so I'm just going to avoid it entirely.
Yeah, totally. Do you think that, I'm sorry, Matt, JMatt, I'm just totally taking over your entire,
okay. You work in radio. You're used to these interviews. You just go however you want.
Never going to put me on again. Do you think that these kinds of things are better solved through therapy? Or is it medication? What is the combination of both? Or how do you see people getting past stuff?
I've seen folks get better with both modes, whether they attack it with the 1-2 punch of medication and talk therapy, or just talk therapy. I've seen people kind of hit their treatment goals and really feel like new versions of themselves, healthier versions of themselves, more at peace versions of themselves, using both modes of therapy. So there are a number of different medications out there that can make those worried moments feel less edgy. Like the world is just, the baseline kind of moves to the world being a less scary place.
Yeah.
And then, talk therapy can help you understand, again, how did I get here? Like, how did this emerge for me? Which, Leigh, you were talking a moment ago about, like, why do I feel like this? I shouldn't feel like this. Well, that kind of rumination piece, gosh, on top of depression, for example, when people think, what should I be depressed about? Why am I even like this? What's wrong with me? Why am I like this? Like, on top of feeling sad and down all the time, you also feel guilty about what you're going through. And it's kind of the same deal with anxiety. Like, why can't I just relax? You know what I mean? But if you were to, again, kind of go back to what we said a moment ago about this fight or flight response, if it feels really scary for you, let's not add guilt onto it. You know what I mean? Let's figure out why it feels scary for you and start figuring out how to help you feel safe in those moments. And boy, when you're able to use coping strategies effectively to kind of de-escalate yourself and remind yourself, like, I've got my husband right here with me. I've told my mom, if I need any help at the mall, I'll the code word rutabaga, whatever it is. Like, I've got my safety plan. I know how to close my ears and take deep breaths and remind myself, you are safe, you are loved, no one's going to hurt you, like whatever your safety message is. The first time you're able to put this into effect and really see it happen, see yourself calm down, it's really empowering.
This too shall pass is my safety message, by the way.
That's great. You know what I mean? Like, knowing that this is temporary. So my feelings are not facts. My feelings are not facts. I'm really wound up right now. I'm really scared, but this is not a factual situation. This is a feeling, a fleeting feeling. Like, I was probably angry about something 3 years ago. I was 2, also a fleeting feeling. Feelings are not facts. Let me kind of take a step away from it for a second. And I'm afraid doesn't necessarily mean that there's a reason to be afraid. So let me kind of put that in perspective for a second. That's another approach that some people can use in the moment to feel better.
Having ways for those experiencing anxiety to cope is certainly really important, but I think Leigh kind of alluded to, like, hey, trying to get my husband to understand what I'm going through, or I'm missing out on opportunities to hang out with my friends. How does somebody with anxiety convey it to their friends and their family and their support network, what they're going through, which I can only assume would be something that would draw anxiety to have to explain?
Sure. So it's tough to be vulnerable with people with whom you don't feel safe. So don't go running to the people who maybe would hurt your feelings or not know what to do with this information. But I sometimes like to frame it up for people like, I need to talk to you about something that's going on with me. And when we're finished, I need you to understand, I just need for you to love me and help me think of kind of some things that I can do. I don't need you to talk me out of it. I don't need you to pep talk me. I don't need you to try to minimize or pretend like it doesn't exist. Definitely don't say you're fine. Like, human beings, we want to kind of fix things, right? Like we want to apply like sort of Home Depot thing. So you tell me that you're
do the most too.
I was thinking it, but I was going to say it.
No offense, Jamie.
Oftentimes your friends, your loved ones, men maybe in particular, who knows, want to sort of Home Depot the problem. Like, what? You're worried? You're scared? What do you have to be worried about? You're great. People love you. Don't fret. Everything's cool, right? And so if you kind of frame it up with people, effective communication 101 in these moments looks like, I need to tell you what I've been going through, and I can't be alone with it anymore. And it's really, really scary for me. I want to tell you what's been happening, and I want to tell you what I need from you. But most of all, what I need from you is to understand, and that's different for each of us. It may be, this isn't your fault. It may be like, this is what's been holding me back from going out with you guys. It may be, can you help me find a therapist, and can you make sure that I follow through? You know what I mean? But to kind of frame up with people, before we have this conversation, let me tell you, I don't need you to X, Y, or Z. I just need you to hear me and know that I'm really, really scared. So I'm making a lot of assumptions there and filling in some blanks, but it's that idea of setting it up for what it is that you need so that people can give you the feedback. It's not a pep talk necessarily. Sometimes a pep talk is the worst thing you can do for somebody who's going through it, right? Saying, can you help me? And can you help me with this?
Yeah.
From the perspective of somebody that doesn't experience anxiety, and I know you basically answered part of this, but I really want those that are watching this that don't experience anxiety but have had people in their life come to them, what is going to help and what should they not do? For example, of like, hey, it's fine, don't do that, but what can someone do to support their friends or family members experiencing anxiety?
That's a great question. So I think trying to say, number one, I will be here for you. And if that means you need for me to listen, if that means you need for us to get together, if that means you need to just send me an emoji that's a code for get here now, whatever it is that you need, let's talk about it. And so just kind of be what it is that they need right now. And that, again, may look like a listening ear. That may look like safety planning. That may look like accountability for making sure they actually call the therapist and not say, I need to talk to someone. Right. So I think being prepared to sort of fill in the gaps for the person, if they've been walking through this alone for a long time, having somebody there with them saying, hey, how you doing today? I saw you posted on Facebook. I just wanted to make sure you're okay. Right. Or just checking in more so than you might normally. And we want to like pretend like life is Starbucks and we're just cool and we're civil and I'll see you when I see you. But having that person who's actually taking the time to check on you. Let you know you are not alone with this. You are not alone with this.
I think I'd like to add to that, and I don't know if this is for everyone, but keep inviting us. Like keep if you're gonna do something and I haven't gone the last 6 times, invite me to the 7th one, because the 7th one might be the day that I can go. And if nothing else, I'm gonna feel like, oh, they do want me around, and they like me for who I am, kooky or not, because at some point I am going to want to go, and I'm using I'm as whoever the person may be, but don't take it as, oh, she never comes, she never
wants to come,
because that's not it. We really do want to show up, we just sometimes can't.
Okay,
that's a great point.
Which I'm sure there's a lot of stereotypes around anxiety, but to me in that moment, I would be thinking, if I keep inviting somebody out and they keep saying no, and I don't know that they have anxiety, I might assume they're introverted. Does anxiety is it exclusive to those that might be introverted, or can extroverts feel anxiety? Does it really matter your personality type in this context?
It doesn't. I mean, I think it might seem like common sense that if somebody's outgoing and talkative, they're probably really cool and don't deal with it too much. But again, it's that feeling on the inside of something's wrong. Something's wrong, or maybe a bunch of things are wrong, or maybe these people, maybe I'm going to be wrong in front of them. It's just that when I say edgy feeling, it's that feeling of something is amiss, right? And I need to be on kind of high alarm right now. So if you don't know necessarily that somebody has anxiety, we talked before about trying to be vulnerable with people you care about. Like if that person keeps inviting you, if you feel safe enough to say, I really struggle with groups sometimes, or sometimes I struggle to get out of the house, or I just need to isolate a little bit, but please keep inviting me. Like that's one of those extending yourself, allowing yourself to be vulnerable things where people will keep checking on you. You know what I mean? And it's survival,
Okay. Yeah.
I think sometimes too, again, speaking for myself, like I'm not an introvert. But I think I almost overcompensate sometimes with the extrovertedness. Like you said earlier, almost being a character a little bit. If I'm going to go out, I'm going out and I'm going big and I'm, going fully, and it's going to be a big zany night. Cause that's almost like a protective bubble for me too. But I don't consider myself an introvert. I consider myself to be outgoing. I just, when I'm out and I'm going, in my head, it's going like a million miles a minute,
Yeah. I know a lot of our conversation today has been around like adults, and because it's our own experiences and all that. Anxiety in kids, that has got to be a topic. And for those that are parents that might notice some of their behaviors in their children, how do we support kids that don't know what anxiety is, that are experiencing anxiety?
A great question. I'm so glad you asked. So right now, there are a lot of children who are acting different. They seem off. Their behavior may seem a little different than normal. They may be, again, kind of edgy and irritable, or cranky is one way we refer to kids sometimes. You may notice some sleep impairment issues. They may be crawling into your bed after 8 years of not doing any of that kind of stuff, regressing in some way. You may just see them acting out. Sometimes behavior is a way for kids to tell us what's on their minds. Maybe a convoluted, hard to read one, but it's a signal, and to be sure. So anxiety in children, you can talk depending on their age and developmental level. You can kind of talk to them about what they were thinking about, or you were really upset a few minutes ago. After the storm is over, you say, kind of wonder what was going on with you. What's on your mind? What have you been thinking about? You can ask them how they're feeling about things right now during coronavirus. Some kids are aware of what's going on out there, and maybe not the full extent of it, but they know something's different. And they know the adults keep watching the news, and people keep griping, and they can't go see their friends, and they can't go to soccer practice. They know something's wrong, and they also probably know the adults aren't telling them, which is sort of a double whammy of anxiety-provoking things for kids. So to say we can talk about it, or to have like the regular rituals, even though the routine may be a little bit off, we still do bedtime. We still do bedtime stories. We check in about feelings. We note. We kind of go into the day knowing children may seem a little bit off right now. And our job as adults is not to kind of meet them where they're at necessarily if they're acting out, but to recognize, taking a step back from it, like they're scared. And the only way that they know what to do with scared is to kind of change how they're acting and like flip out a little bit. So they may have shorter fuses, but our job is to kind of help them feel more at peace and calm. So I'm here with you if you want to talk about this, or it seems like you might be scared or worried about something. If you want to share with me, we can definitely talk about it. There are a bunch of books out there, depending on the kind of age level of the child and what their interests are, that will help assist in kind of understanding this is what this character did when they were worried about something. Wimberly Worried is one of my favorite ones. The Kissing Hand is another good one that's about a raccoon who has to go off to school and leave his mom. So just for books out there for different topics based on what it is that the child may be caring or worrying about, all kinds of stuff out there that can be great resources and a great way to start a conversation.
Is it hereditary?
Say again?
Is it hereditary?
It's a good question. So there is both a genetic and an environmental component. So yes, you might carry some of that in your genes. But also, if you grow up around caregivers who tend toward being anxious or perhaps tend toward being depressed, then you kind of learn that that's how the grown-ups, well, it's something to be aware of. And so let's talk about what to do with that, right? Because it's not a predestined kind of thing. It's just an additional kind of influence, perhaps from the genetic standpoint or the environmental. But if, for example, a child grows up and grown-ups are really scared about money, like the end of the month before paychecks, like everybody really is like high stress and really tense, child might grow up thinking that like money is a big stressor, and if you don't have enough in the bank, you probably are going to be really scared a couple weeks out of the month, right? So financial stress is one of those things that kids pick up on. Anxiety in general, if you see people fretting, if you see grown-ups solving their problems by yelling, kids are going to yell. If you see grown-ups solving their problems by being really scared, biting fingernails, losing sleep, pacing, being irritable, all those things we talked about before, you're going to kind of think that that's how grown-ups approach problems. So we do what we continuously see.
So,
go ahead.
Sorry.
If you don't, let me just like finish the thought real quick, because I think it'll make you feel better, Leigh. If we know that we tend toward perhaps being a little bit more anxious, or that we tend to kind of manifest our anxiety as this behavior that my child probably sees, can be one of those ways for you to know, I need to be talking to them about this, and I need to be talking to them about their fears and their worries, and I need to be monitoring what I'm doing with my worries. So it's okay to say, I'm scared about something, but I'm going to talk to daddy and ask for support, and I'm going to talk about how I feel about it. And if I start to get scared, I'm going to use my big elephant breaths, and you teach them all sorts of strategies, and you teach them that it's okay to talk about it. And then guess what? You never feel like you're alone with it.
Would you say that for an adult or a parent that experiences anxiety, if they are able to figure out healthy ways to cope with their anxiety and display that, not necessarily directly to their children, but they're actively handling their anxiety or whatever they're going through, whether it's like depression or whatever it happens to be, would those kids then also pick up on healthy coping mechanisms, whether or not they have it?
Absolutely. So you say, like, if I start to feel scared, I go talk to grandma, or I talk to daddy, or I have a doctor that I go talk to about my feelings. Like I tell my kiddos that I'm a feelings doctor, and they get that. And then you can teach them strategies that work for you. So there are a bunch of like on Apple Watches and Fitbits, there are breathing apps. And I taught my kids those so they understand, like, sometimes we need to sit still and take a breath real quick while we think of what we're going to do. So you can be passing on healthy coping strategies. And child doesn't necessarily have to have any anxiety behaviors. It can just be healthy coping strategies for what to do when you don't know what to do.
Awesome. I do have another question kind of prompted by Leigh earlier when she said her first panic attack. She didn't really know what it was. She had been seeing somebody about depression, but not anxiety. How common is anxiety impaired with all these other mental health illnesses and all that sort of thing?
It's frequently comorbid or occurs alongside other mental health diagnoses. So there may be a panic episode or a series of panic episodes that add up to panic disorder. You may have a depression piece. There's a lot of overlap with depression and anxiety. So it's kind of that mood dysregulation. And sometimes it may look more like really anxious distress and worry. And other times it may look like kind of what you think of with depression, that sort of low energy, low motivation. I don't find much joy in things anymore, that kind of just withdrawn sort of thing. But you can imagine the overlap if somebody's dealing with really debilitating anxiety or depression. They may look very much the same.
Mm-hmm. Okay. Leigh, do you have any other questions that you wanted to ask our doctor here?
No, actually, this has been really informative, and I may just need to get her info from you when we get off the air here. No, but I think it's been a good reminder today to continue talking with someone. I know, JMatt, you've talked on some of your other ones about how you've been doing the virtual therapy and, just having 3 babies and moving and COVID-19 and all of the things. And that's one more thing to figure out when you get to a new town is, okay, now who do I go find to talk to? And you've had good luck with that, haven't you, JMatt?
Yeah, I've used BetterHelp. And the nice thing is, in my opinion, with any therapy, if you go to someone, whether in person or with an app, and you just don't think it's a good fit, that's okay. You can find another therapist. I think a lot of people will go to therapy, have one bad experience, and say, therapy's not for me.
Totally. And I think in general, what you're doing is awesome, just bringing a lot of this stuff to light, because when people don't talk about things, whether it's depression or anxiety, or, when my husband and I had fertility issues or all those kinds of things, they just don't need to be hush hush. And I think people will probably have less of it if we're able to just communicate about it.
I agree. Dr. Buehner, is there anything that you would like to add before we end?
No, I really appreciate the opportunity. We covered a lot of ground today.
Perfect. Very cool. Before we get off, I'm just going to tease my next 2 episodes. I've got next Sunday, June 7th at 3 o'clock. We're talking about schizophrenia with Cody Green, who is somebody that experiences schizophrenia and is very aware of it and very open about his experiences. Then on June 14th, we're going to be talking about eating disorders, which with Paige Pickler, who is local and has worked with Project Heal. We'll find out more about that. If you, the viewer, have any topics that you want me to cover or any guests to bring on, please feel free to DM me and let me know. Otherwise, thank you for watching and thank you for taking time out of your Sunday to be a part of this.
Thank you.
Bye, Leigh.
Bye.